How soon do you think you'll know how your vaccine performs against Omicron? Do you have a better sense of exact timescales, maybe even an exact day?
Yes, we will certainly learn about in the next 2 to 3 weeks if we get indication that the vaccine is working. Overall, we are doing 2 experiments. Number 1 is certainly that we used sera from people vaccinated with our vaccine and see if they can neutralize the virus. And second, we are screening on a global basis the effectiveness data to see if there are breakthrough cases. You have just communicated that there are increases in South Africa. So we are getting this data like in an online format.
Ralf, good morning. Look, we've got billions of your doses, your current vaccine ready. How much of a change in effectiveness for Omicron is it worth it for people to wait and switch over to a new one that's tailored towards Omicron? Like, is it 10% difference in effectiveness, or what is that kind of decision process based on?
Yeah, it's not worth to wait. I think it's important that we continue with the booster program as there are recommendations in all countries. We don't expect that there will be a significant drop in effectiveness, but again, this is speculation. We will check this. We will have the data in the next couple of weeks. When you talk about booster programs, there are 3 important observations with booster program. Number 1 is that you strengthen the immune response. And number 2 is you also increase the breadth of coverage. That means when you booster, you get a better protection against new variants. That's certainly something we will also observe with Omicron.
You say you don't expect a significant drop in protection when you think about the existing vaccination that Pfizer and BioNTech have made, Ralf. We heard from Moderna, they were talking about a material drop in effectiveness. Obviously, you can't speak for them, but I just want to confirm you don't see it as likely that there will be a material drop in the effectiveness of your vaccine.
Likelihood is speculation, and I think because we know how difficult it is to speculate about the consequences, and I think it's dangerous to speculate and I know that this has been done in many countries. I think we should do the experiments as rapidly as we can do it, and then in a very few weeks we are knowing that how severe this disease is. If this variant is really an escape variant and takes over the place Delta has at the moment, the unfortunate place of Delta, and then we have to do the experiments and we will have the data very soon. When I looked at the molecular structure, there are 11 amino acid changes. Many amino acid changes are similar to what we have seen with the Delta and the Beta variant. And there are some additional mutations, but the clinical significance of those mutations is unknown. So I think we really have to wait for the data. And I don't expect that there is a significant drop. If there is a significant drop, then Pfizer has a playbook to develop a new vaccine. By the way, we already started the development of 2 other vaccines, which in the end, we didn't use because with the booster dose, there was a good protection of community against the Delta variant. So we are prepared. We have a playbook. Yep. I think that's important.
I believe there's been a report that the UK has pre-ordered your vaccine that's tailored for Omicron. What happens if we find out in a few weeks' time that it's not more dangerous, it might be a little bit more contagious? Will countries that have pre-ordered be able to pick and choose between your current vaccine or the Omicron tailored one, or how does that work?
Well, based on those speculations, we should not make that more complex. If countries have ordered our vaccine, they will get the right vaccine. In all contracts, Pfizer has committed that we will provide the right vaccine to fight against the pandemic. So in other words, if our current vaccine works against the new variant, we will continue to supply, and just keep in mind, we are supplying for billion doses, not million, billion doses globally. So we will be able to provide this large amount of vaccine in a record time.
Ralf, can I ask you a bit more about percentage effectiveness? Because as you point out, there's still work to do to work out what is the percentage effectiveness of the existing vaccines against this new variant. I mean, what do you do with that information? Whose decision is it then as to whether it is worth producing a new vaccine? I imagine the decision is very different if you get 90% effectiveness versus 10. So who decides? Is it a clinical or political decision?
No, in the end, it's a medical decision. So I think when we developed mRNA vaccines, we were even surprised by the high level of effectiveness of mRNA vaccines. 95%, that's a lot. And compare it to other vaccines, 95% is really a landmark. And then the second point I want to raise, you have to think about effectiveness against what? Are we talking about effectiveness against infection? Or are we talking about effectiveness against hospitalization and severe disease? Just keep in mind that against the Delta variant, even after 6 months, the effectiveness against hospitalization remains at the highest level. It's only that the effectiveness against infection went down to 40–50% after 6 months. And therefore, we have developed a booster program. With the booster program, we were able to reinstall a 90% plus effectiveness against infection and hospitalization. So as long as this is working, we are good with the booster dose. And we also have now to analyze if the same is true for the Omicron variant. Pfizer has established a few what we call surveillance sites globally, and we get online surveillance from all countries. We also work together with the UK health authorities. We have meetings. They share the data with us. Yeah. It hasn't been done in the past. They share the data with us on a day-to-day basis.
Ralf, can I ask you, talking about how your booster provides up to 90% plus effectiveness once you get the booster, what do you think about people who are seeking to mix their initial vaccine versus booster? I got Moderna. Should I get Pfizer as a booster, or should I continue with Moderna? What is your perspective?
Yeah, so first of all, our label says that you should stick with one vaccine. And it was certainly not possible in the initiation of this horrible pandemic. Some people started with some other vaccines with AstraZeneca and Moderna. Actually, it's the UK health authorities who have presented excellent data on that. For those people who have received AstraZeneca, it's safe to give an mRNA vaccine. So mRNA vaccine, as of today, are safe and immunogenic to be used as a booster dose and give a protection against the current variant, which is the Delta variant. And what Omicron will tell us in the future, we are working day and night, and we will let you know as soon as possible what are our decisions on that. Again, it's not that we start from scratch. We have a playbook on that. So we know what we have to do. We did this already for the Beta and the Delta variant. We were even developing a new vaccine. If we saw it's needed, we would have developed it.